Hi, I'm Congresswoman Terry Sewell of Alabama's 7th Congressional District. It is a pleasure to speak to you on your 33rd Annual National Black Nurses Day on Capitol Hill. To your Executive Director, Dr. Millicent Gorham, I'd like to thank you for your invitation today and for your commitment to putting an end to the racial and public health disparities in Alabama and across this nation in our healthcare system. I also want to recognize the fabulous folks from Alabama that have leadership roles within the National Black Nurses Association. Your national president, Dr. Martha Dawson, and your second vice president, Dr. Marcia Lowe, both from Birmingham, Alabama, my constituents. I think we can all agree that 2020 was a year like no other, given the global threat of the COVID-19 pandemic. The true heroes and sheroes of this pandemic have been you, our frontline healthcare workers, our nurses. You have risked your own health and safety and made sacrifices to care for our families, our friends, our neighbors who are suffering from this horrible coronavirus. This year's theme of your conference, COVID-19, Social Justice and Health Equity, reminds us of the work that we have to do to help our communities. Sadly, this pandemic has inflicted a devastating and a disproportionate toll on the health and economic wellness of the Black community across this nation. In the face of these grave challenges, our nation's nurses have met the challenge. All of you have gotten to work, helping to keep our loved ones healthy and our communities running. I want to say thank you. It doesn't seem enough. There is nothing more important to me as representative of Alabama's 7th Congressional District than reversing the economic and health trends that made our communities more likely to get COVID-19 and to not be able to withstand the economic downturn as a result of it. As Black nurses, your advocacy on issues of public policy on healthcare and the delivery of medical services is so critical to informing state and national lawmakers. I want to encourage this national association and your local chapters to contact your state representatives as well as members of Congress regularly for briefings in your community about your needs and concerns within the healthcare sector. A shout out to my Black nurses in Alabama. We recently elected the first African American nurse to head the executive board of the Alabama State Nurses Association, Dr. Lindsay Harris, and also a special recognition to the Birmingham Black Nurses Association, led by Dr. Deborah Zimmerman, who provided invaluable input to me and my staff this summer on a very special briefing that we had on the needs of nurses during the pandemic. So my advice to all of you is to make sure that your voices are heard. It's so important. While the COVID-19 pandemic has tested us all, especially our healthcare professionals, I do believe that we're finally turning a new page. Now more than ever, I truly believe that hope is on the horizon. Help is truly on the way. Under the Biden-Harris administration and a majority Democratic Congress, I know that we will pass bold legislation that will give our communities the resources to fight this pandemic and to advance racial equity in our healthcare system. This week, I joined several of my colleagues in introducing the Black Maternal Health Omnibus package legislation that will comprehensively address America's Black maternal health crisis. My bill is a part of that package, the Maternal Vaccination Act, which would provide better access to vaccinations for mothers and their children in communities with historically low rates. I am hopeful that we will be able to secure critical support for our essential workers in the COVID relief legislation this year. It is my belief that all of our nurses and essential workers who have sacrificed so much during this pandemic deserve heroes pay and student loan relief, and I will be fighting for it in Congress. I want to assure you that I see you and I hear you. I remain committed to doing everything in my power to address the concerns that you have and to ensure that you have the support to fight this virus and to help our vulnerable communities. Thank you again for all that you do. Be blessed, be safe, and I look forward to fighting for you and the patients that you serve this year and throughout this Congress.
Hello, everyone, and congratulations on your 34th annual National Black Nurses Day on the Hill. I wish that I could be with you in person, and I look forward to seeing your faces on the Hill again, hopefully next year. As chair of the Congressional Black Caucus Health Brain Trust and co-founder and co-chair of the Caucus on Black Women and Girls, I am a big fan of your work to support Black women in this field. It is so important to diversify and provide support for Black women to join the healthcare workforce. I've been working to improve Black maternal and infant health outcomes since coming to Congress in 2013. I am pleased that part of my legislation, the Mamas Act, has been included in President Biden's Build Back Better plan, and I look forward to this legislation passing soon. This will bring 12 months of postpartum coverage to Medicaid beneficiaries in every single state. I know I don't have to tell you how transformational that healthcare access will be. I'm also working to improve clinical trial diversity through my Clinical Trial Diversity Act to ensure that we are including more people of color in our research and in our healthcare solutions. I know that is a shared priority of ours, and I look forward to your feedback on this legislation. Finally, I want to thank you for the work you have done throughout the COVID-19 pandemic. I know that many of our Black nurses and other healthcare professionals have been on the front lines of this fight. I want you to know how grateful I am for you, and I express my heartfelt thanks. Please stay in touch with my Office on Health Equity Issues. I look forward to hearing from you, and thank you so much again.
I'm Congresswoman Brenda Lawrence, and I proudly represent Michigan's 14th Congressional District. I'm honored to be able to participate in the 34th Annual National Black Nurses Day on the Hill. I am told that 180 nurses of all levels and nursing students are participating in today's event. Your advocacy does not go unnoticed. It is important for you to talk with your elected officials and share the legislative priority of Black nurses. Your voice is one of the most important tools you have to make real change. I want to say thank you to each and every one of you for your dedication, commitment, hard work, and yes, I recognize your sacrifice, especially in the past 2 years. You've gone above and beyond on the front lines of this pandemic to keep our country safe and healthy. I know that together we can achieve your association's call to action. As the second vice chair of the Congressional Black Caucus, I'm helping to lead the fight to support our healthcare workers, tackle our country's Black maternal mortality crisis, and end health inequities in the Black communities. I will always be an advocate for you in Congress, and I will have your backs. Thank you for everything that you do. Thank you for taking care of all of us. But I ask you to please take care of yourself. We need you so much. And really look at innovation, because in this pandemic, it's all hands on deck. And being nurses, and particularly Black nurses, I know that the innovation that's needed to carry us through this pandemic rests in your hands. I thank you for allowing me to speak, and I look forward to seeing all that you are going to accomplish.
Hello, I'm Donald Payne Jr., Congressman for New Jersey's 10th District. It is an honor to participate in your National Black Nurses Day. I want to thank Martha Dawson, President of the National Black Nurses Association, for the invitation to speak with you today. It is an important time to be a nurse in this country. Our battles with COVID-19 and its variants has shown your work is critical to the health and safety of all Americans. But your skills and training are even more important in our African American communities. Recently, there has been a greater emphasis on the unique health care needs of Black Americans. In my role as chair of the Congressional Men's Health Caucus, I work to create more awareness of these issues. For example, I've been a strong advocate of efforts to decrease limb amputations in African Americans with artery disease. In addition, I continue to work to increase awareness and funding for those efforts to decrease cancer rates and deaths in our communities. But my efforts are only part of the battle to improve American health care. You are the ones in the hospitals and clinics that keep Americans alive. You are the ones who are able to identify health challenges faced in minority communities. And you are the ones making a difference every day in every way. So thank you for the work that you do to protect and better the lives of all Americans. And let me know how I can continue to support those efforts in the future.
Hi, this is Congresswoman Lucy Mcmahon, and I am so pleased to speak with you for National Black Nurses Day on Capitol Hill. The last 2 years have been so incredibly difficult for those across the country who do the hard work of keeping our families together. And as you mobilize around issues of health equity, resilience, and innovation, I want to offer my profound thanks to the nurses, LPNs, and healthcare professionals who've been truly making a difference every single day. Your work has saved the lives of countless mothers and fathers, and your efforts have kept families from experiencing the pain of losing a loved one. So for all of you who may be feeling down, I hear you and I understand you, and I hope you find some solace because you have truly made a difference, and you will keep making a difference, and you have helped to save lives. You help to prevent unimaginable grief. Healthcare isn't a single moment in time, but a lifelong effort. The health of our friends and our families and loved ones is never far from our minds. Like many women in America, my story includes a struggle to get pregnant. My son Jordan was a miracle for me and my family, but for too many mothers, the miracle of pregnancy often ends in tragedy. That's why I'm proud to be a member of the Black Maternal Health Caucus, why I've helped introduce the Omnibus, and why I appreciate each and every one of you and your efforts to lift up equity in the healthcare space every single day. Once again, I want to thank each and every one of you for all the work that you're doing to keep our families healthy and whole. And I pray that you give yourself some grace, because we all deserve a little grace. Please remember that you are loved, you are cherished, and you are most definitely not alone. Thank you all, and God bless.
Our country is so fortunate to have nurses as champions as we fight to eliminate health disparities, to create a more representative and inclusive healthcare workforce, and increase investments for communities who have historically lacked access to healthcare. It is no coincidence that nurses year after year are recognized as the most trusted profession. And I'm committed to working alongside nurses to address today's most pressing healthcare issues. America's mental health crisis has been overlooked for far too long. Too many Americans with mental illnesses slip through the cracks and are abandoned by our healthcare system. I introduced and passed through the House of Representatives the Pursuing Equity and Mental Health Act, to ensure that youth of color who are dealing with mental health issues have access to culturally competent providers. This legislation also directs the National Institute of Health to require at least a quarter of all research grants to go to community-based research to ensure issues impacting minority communities get researched. Mothers have also been overlooked in our healthcare system. The U.S. has nearly the highest maternal mortality rate among high-income countries, and in fact, it is the only industrialized nation in the world where maternal mortality is rising, and Black mothers are at the greatest risk. The Build Back Better Act is one step towards addressing the Black maternal mortality crisis and will ultimately save lives. The act includes a key provision of My Healthy Mom Act. This historic legislation will create a mandatory permanent extension of postpartum Medicaid coverage for 12 months after delivery. The Build Back Better Act also includes critical investments to improve maternal health care and reduce maternal mortality and morbidity. Specifically, BBB provides significant funding to address social determinants of mental health, growth, and diversify the perinatal and douula workforce, address maternal mental health and substance use, study maternal mortality, and reduce avoidable racial and ethnic disparities in maternal health outcomes. As our country continues to grapple with an ongoing pandemic, we need more resources and more research that addresses the systemic factors that produce inequities in access and outcomes. We are making progress, but much more needs to be done, and we need to keep fighting to invest in our nurses, who are the backbone of our healthcare system, and center equity to close health gaps. I hope to have you as a partner in this fight. Thank you. God bless you, and God bless your work.
Peace and love, everyone. It's Congressman Bowman here. I'm honored to join you all virtually today for your National Day on Capitol Hill. I want to thank you for all the work that you do. Our world needs more Black people in the medical field, especially as this pandemic continues. Your presence in the medical world is acknowledged and much appreciated. This year's theme of health equity, nursing resilience, and innovation as your call to action is critical when we discuss what laws and resources are currently in place. My sister works in the healthcare field, and I've seen firsthand some of the obstacles she has had to handle in terms of equity, while also keeping her spirit to serve her patients and keep people healthy and alive. Just like you, she takes joy in her profession and only wants the absolute best for not only herself, but her patients. The Black community is adversely affected in so many ways, so many areas when it comes to our health, in terms of maternal health, mental health, cardiovascular health, and even with basic access to healthcare. We are all falling behind on equitable levels of treatment and access. I wish you all the best on your journey today to meet with my colleagues on the Hill, and just know I am committed to supporting you and all of your work. Thank you for your courage, for your bravery, for your love, not just for our patients, but for this country. We need you and we love you. Keep doing God's work. Peace and love. Thank you all.
Joe Neguse here, proud to represent Colorado's 2nd Congressional District in the United States Congress. And I am so delighted to wish you all a happy National Black Nurses Association Day. Throughout the pandemic, our nurses have been on the front lines day in and day out. We owe them so much, and each of them a debt of gratitude. True American heroes at a time of great consequence and great challenge. Since 1971, the National Black Nurses Association has worked to serve as the voice for Black nurses and diverse populations by ensuring equal access to professional development, promoting educational opportunities, and improving health. This work is critical, and I am so grateful for all of your efforts and your leadership in that regard. In Congress, my team and I are working with the Congressional Black Caucus and many others to ensure that all of our healthcare providers have the support and the resources that they need to continue providing quality, affordable healthcare to our communities. From working to lower ballooning drug costs to providing funding for improved healthcare facilities. It's my goal, our goal, to stand up for care providers like yourself every day as you have stood up for us. So thank you again for all that you're doing. Please stay safe, stay healthy, and stay hopeful.
I'm Congresswoman Hakeem Williams, and I proudly represent Georgia's 5th Congressional District. I want to extend my warmest welcome to everyone taking part in the 34th National Black Nurses Association Day on Capitol Hill. The 5th District is home to multiple nursing schools and several of the country's best medical systems. During the COVID-19 pandemic, it's been nurses, and primarily Black nurses, who've been on the front lines caring for patients and saving lives. I was one of the first people in the state of Georgia to contract COVID-19, so I know how awful the disease is, and I want to thank all of you for everything that you're doing in your communities to stop the spread. When I read the theme for today's agenda, health equity, nursing resilience, and innovation, I felt an immediate affinity because your agenda items are some of my top priorities in Congress. That includes improving the Black maternal mortality crisis. Georgia has the highest Black maternal mortality rate in the country. So y'all, if you don't know the numbers, they are terrifying. Black women in Georgia are 3 times more likely to die from pregnancy-related complications than white women nationally. So your work is very much a matter of racial justice, because many of the deaths can be prevented by expanding the healthcare expecting mothers need and from the caregivers who understand the unique health challenges facing Black women. That's why I was an original co-sponsor of the 2021 Black Maternal Health Omnibus Act, led by my colleague, Congresswoman Lauren Underwood, and the Medicaid Saves Lives Act. These 2 bills would provide the comprehensive approach needed to decrease Black maternal mortality and close the coverage gap in states like Georgia. At the heart of that are Black nurses, who are so often the first caregivers everywhere in the country. But y'all, Congress can't do it alone. We need groups like the National Black Nurses Association fighting for our communities to get the care that they need and deserve. I'm proud to stand with you today and every day to amplify your voices. Together, we'll make sure that everyone in this country has access to the medical care that they need and deserve, no matter their zip code, no matter their bank account.
Hello, I'm Congressman Hakeem Jeffries, representing the 8th Congressional District of New York, and also serve as chair of the House Democratic Caucus. Welcome to Capitol Hill. Such an honor and a privilege to greet you virtually, and I'm so thankful for the work of the National Black Nurses Association and the Greater New York City chapter for your service and your sacrifice and all that you continue to do for our community, for the poor, the sick, the afflicted, the least, the lost, and the left behind at all times, but particularly over the last several years in the midst of this COVID-19 pandemic, a once-in-a-century crisis that has caused so much pain, so much suffering, so much death and uncertainty in our community and throughout the country. However, because of your work, because of your effort, because of your professionalism, because of your compassion and your advocacy on behalf of those who need a strong healthcare system, I'm confident that we're going to be able to make it through this storm, and the best is yet to come. Thank you, thank you, thank you for your work. Thank you for your presence on the Hill. Thank you for all you do as healthcare heroes. God bless you all. God bless the National Black Nurses Association, and God bless the United States of America.
This is U.S. Representative Marilyn Strickland from the 10th Congressional District of Washington State. It is my honor to be here with you today to celebrate National Black Nurses Day. When I took office as a freshman in 2021, I never imagined that we would still be in a pandemic, but here we are. And as I think about the work that you have done on the front lines to care for our communities, I just want to say thank you. Thank you on behalf of the 10th Congressional District of Washington State. Thank you on behalf of our state, and thank you to a nation that appreciates the work that you do. We know that we have a history of caring for people. Caregiving is part of what we do. But we also know that caregiving is something that requires so much patience, tenacity, and of course compassion, and you have it in droves. So a nation is so grateful for the work that you do. We want to make sure that you know we honor you, we respect you, and we are so grateful that we have you in the trenches during this pandemic. We hope you stay safe and healthy. We hope that people watch over you and make sure that you're getting your needs met. And again, thank you so much for the work that you do, caring for our communities and caring for our nation.
Today is National Black Nurses Day, and I want to take a moment to thank all Black nurses who have committed themselves to the health and well-being of all Americans. I'm proud to have supported several pieces of legislation that protected our nurses and healthcare workers, including the CARES Act and the American Rescue Plan. These pieces of legislation have provided billions to combat COVID-19 and strengthen our nation's healthcare, including $40 million for healthcare providers to promote mental health among the health professional workforce, $20 million for healthier work conditions in our healthcare professionals, and $200 million for the Nurses Corps to support scholarships and loan repayment for students, nurses, and advanced practice registered nurses. We still have challenges ahead, from reducing Black maternal and infant mortality rates to addressing health inequities among Black communities. But I'm confident that Black nurses across this nation will continue to rise to the challenge and make our nation the better for it. I thank you for all that you do to serve this great nation.